Hey girl, hey, it's your birth bestie Nurse Rini, and I am back with another video for you. Today we are going to talk about how to know whether or not you're in labor. So let's dive in. So our objectives are to first understand what contractions actually do, how to monitor contractions, and when to call your doctor. So first, let's talk about what contractions are and why they matter. Contractions are the tightening of the uterine muscle. The uterus is a muscle that expands when you grow a baby in it, and then it contracts to cause cervical dilation. Contractions can be the sign of labor. They are not the same as Braxton Hicks. However, contractions can also come on because of dehydration, infection. Again, contractions are not Braxton Hicks. And you're like, Rini, well, how do I know? Contractions are typically a bit stronger than Braxton Hicks, and then they last. They do not go away, and then they increase in intensity over time. Contractions cannot just be stopped, right? But Braxton Hicks can be stopped, and they usually come less intense and then they disappear altogether. So ladies, get your partners in the room because they are going to be the ones to monitor the contractions, and that's what we're going to go over right now. Partners, you can time contractions with an app. I'm sure there's one available, or you can just go ahead and use a good old clock and time contractions that way. But the way you want to time contractions will be from the beginning of one contraction to the beginning of the next. So the little visual there will demonstrate how to measure contractions and how they look to us on the monitor. So we have the start of contraction as it goes up the incline. It gets to the very top of the mountain and it peaks, and then it starts to descend. And you will see that your partner is experiencing a contraction in that same way. She'll know it's coming on. She'll feel it build. She'll get to the height of it, and then she'll feel it decrease. Then it gets back to the bottom, the baseline. And once that cycle starts again, that will then be how far apart the first contraction was to the next. So we are going to go over when you should call the doctors. Now, my caveat is this: always call your doctor if you're ever concerned. However, in this case, we are talking about calling your doctor when you think you're in labor for first-time moms and for mommies who are more than 37 weeks pregnant. So if you have a full-term baby, which is 37 weeks or greater, your baby is head down and you are not a scheduled cesarean section and you are a low-risk pregnancy, I'm trying to dot all my I's, then you want to call your doctor when your contractions get to around every 5 minutes apart. And this is because contractions have to build regularity. So you'll see at first when you have contractions that it may be one every 20 minutes, one every 30 minutes. And as time goes on in early labor, you will start to experience your contractions much closer together. So your doctor will want you to come in and hope that you are in active labor, which is 6 centimeters or more. The reason the doctors want you to be in active labor is because it'll lessen the amount of time that you are in the hospital. And to be truthful with you, and you know your girl is going to be truthful, okay? To be truthful with you, once you're in the hospital, doctors seem to fidget and then they want to start doing interventions, right? Your baby's going to be on the monitor. They're going to want you to get into labor. Your water may break and then they may feel even more pressure to get you into labor. They want you to come in, hopefully already at that stage where you will just continue to progress until you have your baby. So again, once your contractions are every 5 minutes, they are lasting for at least 1 minute, and this has been going on for about 1 hour, then we can say safely, hopefully, that you are having cervical change. So call your doctor and head on into the hospital. So once you call your doctor and they say go to the hospital and get checked, you will walk into the triage of labor and delivery, right? It's like going to the emergency department if you've ever experienced that. You check in and you tell them why you are there. In this case, you'll say, I'm having contractions, I'm 38 weeks pregnant, and they will be like, okay, she's here for a labor check. They are going to bring you to the back, put the baby on a monitor to make sure that the baby is doing well and tolerating those contractions. They're also going to ask you a ton of questions, but they'll also check your cervix. And so if you're just 2 or 3 centimeters, then they may say, okay, you can go home, or they may have you walk around and come back to be rechecked after about 2 hours, or they may just go ahead and admit you because you are in, hopefully, active labor, which is about 6 centimeters dilated. So to recap, partners, you are the ones monitoring the contractions. Partners or support people, whoever that person is for you, you're going to monitor the contractions from the beginning of one contraction to the beginning of the next contraction. You want your contractions to be at least 5 minutes apart. You want them to be lasting for 1 minute, and you want this pattern to have been going on for at least 1 hour. However, if you are at all concerned, call your doctor. This video is for low risk pregnancies that don't have any kind of complications or anything. But if you feel like something is off, you're always going to want to consult with your provider. And in fact, take this video, take this information and show this video to your doctor, or just say, hey, I watched this video. They said X, Y, and Z, just to confirm that this is what your doctor wants from you as well. I hope everything goes well for you, my friend. Make sure you watch the video on Pitocin and labor inductions. And yeah, I'll see you next time. Bye. Hey guys, it's Editing Rini here. I wanted to say, if you found this video helpful or any of the other videos on the channel helpful, please be sure to share, like, comment, share, and follow for more.